So I know you're a nurse, so tell me about, how long have you been a nurse?
For 5 years.
What do you like about it?
I'm a pediatric nurse, so I love getting to work with babies and young kids and adolescents. It's kind of a passion of mine.
So do you work at the hospital in the pediatrics, or do you have a somewhere else?
Kind of. So I technically work for Helen DeVos, but I am in their residency clinic. So we kind of have the specialty of getting all of the med students who have graduated and have to do their, time, to learn how to be a doctor.
What do you think about the new doctors?
I love the residents. I do. Yeah, they have a special place in my heart. I never knew how much I liked education until I found this job, so it's very
exciting.
They're
green, aren't they? They just don't. They want to be doctors.
Yes.
They're like, so when I was in grad school, one of my partner for gross anatomy lab was a 20-year emergency room nurse, and they got the new residents from a training hospital, and she openly said, "You know what? I don't want you to feel, I've been doing this for 20 some years." She became a chiropractor, she's not a medical doctor.
Wow.
And she goes, I hear, and the rhetoric is, chiropractors aren't good enough. She goes, you need to understand something, you guys are good enough. Because I spent 20 years keeping new residents from killing established patients in the emergency room because they don't know anything.
Yes.
I really goes, yeah, trust me, it's a dangerous world out there.
Yep.
Don't go out of the emergency room.
Every July we get a new bunch of them, so.
It takes a while to get the knowledge. I mean, you can get books smart about subjects, but the real world is a whole different ballgame of procedures and flow, and I just never could do it. That's all. I'm going to be a chiropractor and do my musculoskeletal work, and I don't like to be but blood. No one's going to throw up on me. One time. But it's just a non-violent scene. Yeah. And then I can work nutrition and lifestyle. But pediatrics sounds pretty fun.
Yes, I love it. I can't picture myself anywhere else.
That's what you want to do for,
Adults kind of suck, so. If I'm being honest.
Yeah, I know. People, we all come from different backgrounds, and we all have our own good days and bad days, and you never know what you're dealing with in a moment, so you always have to assume it's just like, hey, it's a bad day, how can I help?
Right.
But did you always choose pediatrics?
No, I didn't actually know what I wanted to do. So I started off as an LPN and then went back to school for my RN, and I'm actually one class away now from my bachelor's degree, which is pretty exciting. But
do you think you'll stay at that level? I know some of the universities now are doing PhD level nursing.
Yeah, I don't know. I don't really.
It's a lot more years of schooling.
I'm not sure. I think I'm going to take a break from school for a while and then just kind of see where the world takes me.
Just be a nurse for a while.
Yeah, just be a nurse.
I mean, it seems to be there's a lot of learning you can do and certifications just around that field.
Oh yeah, I mean the world's kind of my oyster. I can do whatever, go wherever, and learn stuff every day. So. And
the important thing is to keep learning.
Right.
I know from my continuing ed, I average about, with 30 credits every 2 years, I average about 100 hours a year, just constantly studying, and it's still not enough.
Yeah.
So just think of all the things you can just constantly spend time to say, what do I want to learn?
Yeah, and I'm still so early in my career too that I've got, the whole rest of my life ahead of me to learn.
The more you stay active, the better you are, the more you are at your craft.
Yeah.
So.
Exactly.
So I know, so you're a nurse, you've been doing that for 5 years, which means a lot of standing. Do you work days or nights?
Days.
Days.
Yep.
So that can be busier.
Yep.
So how's your body feel?
Tired.
Tired?
Yeah, I don't have to move like heavy patients a lot, which is kind of nice, but still tired. Lots of, up, walking around, just on your feet quite a bit.
And you're 12s, right? Most hospitals are 12s.
I was doing 10s and now I'm down to 8, so I work 5 days a week right now.
That's better than some of the 12s.
Yes.
3 on, 2 off, whatever. That crazy rotation.
Yeah, I don't have to do weekends, which is nice. So.
Nice. How'd you manage that? That's like a seniority thing.
I don't know. I got really lucky.
I got a lot of nurses and doctors here, and they're like, it's a rotation on the weekends,
I got lucky. I'm not gonna lie.
That's 5 years in, and you're working days on 8s. That's a sweet deal.
Yep.
No wonder you like 8s. I wouldn't believe it. Okay, so then I know from history we've talked a little bit. I know you got some fatigue and other issues we want to work on. You said about an auto accident you had some neck pain. So tell me about that.
Yeah, so that was 7 years ago, 8 years ago, and I never really had migraines or neck pain until then. But I was sitting at a stoplight and somebody rear-ended me going about like 40 miles an hour, and my airbag never deployed. Yeah. So I went, ragdoll into the steering wheel and a nice contusion across my face. And
so you hit it across here or down in the face?
Kind of like across like this, yeah. So that happened, and the first thing I did was call my dad because I was young, and he was so freaked out. We just went home. I probably should have gone to the hospital in hindsight, but you know, that was the first car accident I've ever been in, and, you know, we were like, oh, if the airbag didn't go off, it couldn't have been that bad. But then lo and behold, as the years went on, the migraines came, the neck pain came, and it just kind of never went away.
And you've been, so that was 7 years ago. How old are you right now?
I just turned 30 in August.
So you're going back to 21, 22, or is it 7 years ago?
Right about that, yeah.
And so you were rear-ended at 40, hit your head, the whiplash. You were in college at the time, or finishing up, or somewhere else.
Yeah, in college.
Okay. And any other traumas beyond that time period?
No, nothing I can think of.
Any sport traumas?
Nope, I didn't play sports.
You didn't play sports? Okay. Do you exercise at all now, where we are in time?
I used to pre-COVID.
Okay.
I was going at like 4:30 in the morning before work.
Why do people do that?
I know.
The body does not like to be up at
Because when I go get home, I can just sit on my couch and do nothing. So that was my motivation. I didn't have to worry about it. But I haven't so much because I haven't been able to go to the gym. My gym's not opening that early. I've been trying to do it at home, but I don't have motivation to work out at home, if I'm being truthful.
I get it. It's hard. Any injuries in the exercise when you were doing anything?
No, and I don't know if it stems from my accident, but it's just this shoulder, like kind of back on my shoulder blade has always been like it feels a little pinchy.
Okay.
But other than that, no injuries.
So right shoulder's pain. You hit your head 7 years ago. Got some neck issues still stemming from that?
Yeah, just like it just. I don't really know how to describe it. So before I started with you guys back in the summer, it was kind of always just felt really tense and tight, and I would get, migraines on one side. They start at the base of my skull and go
on the left side and go around front.
Yeah, or they'd switch sides, and I did injection therapy for a year or two and tried that. And
what happened? Didn't do anything.
Nothing worked. Yeah.
So you've had some chiropractic care. I know that. Has it helped?
Yeah, I definitely am feeling better than where I was. I noticed that my migraines have not been as severe when I do get them, which is nice. But
how often are you getting a migraine?
Right now, probably once or twice a week.
Still too much for my blood.
Better than what it was.
Yeah.
Okay. I was at like probably 15 to 20 a month for a really, really long time.
Just constantly nipping. But we've got more to do, and we'll talk about, maybe another video we'll go through some nutrition. We're thinking about doing some nutrition work.
Yeah.
Because you also expressed the desire to have some weight changes on you, but there can be nutrition effects into the brain, because you did hit your head.
Right.
And there is a possibility. Did you have a concussion? Did they verify any concussions on those?
No, because I never sought care afterwards, but I mean, it wouldn't surprise me if I did. I had a nice contusion,
What we might want to do down the road is we might start some nutrition work and do a video and kind of do some post interviews and see if that's another level that's changed for you. We can do a follow up on that one down the road here. So I want to focus on the chiro today. So pretty much that's the biggest trauma is a rear-ended at 40 miles an hour, whiplashing your face into a steering wheel. Yeah. That had to hurt.
It was great.
That sounds painful. Let's take a look at some stuff. I'm gonna have you sit up here. I just want to do some more feeling. We've made a lot of changes, but I still don't like some of this. Now, how does it feel when I palpate into here?
Yeah, it's tender, where your fingers are.
Okay. And how about on this side?
Yeah, same with that side.
Same this side. Let's do some nerve checks here. So bring this arm up. Hold right there for me. Don't let me push the arm down. Hold tight. Still kind of weak. Let's bring this one up. Hold tight. Don't let me push it down. Strong as you can. And there's nothing in there. So let's do the bicipital reflex. I'm going to bring in. I'm going to push straight down, hold tight, and don't let me push it down. Here we go. Pretty weak there. So once again, as you know, we're always about tone and strength. Hold tight for me here. That's a little weak. And you got some muscle tightness there. Bring this arm up. You're going to have to do a tricep extension. Push as hard as you can there. Hold tight for me. And there's nothing. And push hard as you can here. Up. And there's nothing. I want to do some with the neck. If I take the head straight back, do you get any pinching or pain when I do that at all?
No, not back.
So that's a good sign. Some things have changed. Now, I'm going to take it to the side and circumduct back. How does that feel?
It feels very little pinchy on this side.
A little pinch on the right?
Yeah.
About where?
Like here.
Okay, up the neck. All right, we're going to work on that. So we're pinching right about mid-neck there. Okay. Let's do this side and back. How's that feel there?
Same thing.
Same
pinch,
thing?
Yeah, pinch, same area.
So I'm feeling restriction right about there. All right. Right, so what I want to do now is I'm going to get you on your table, face down on this table over here. We're going to just start some basic muscle work, loosen you up. How's that feeling here?
Kind of sharp.
Sharp pain right there?
Mm-hmm.
Alright, and then I'm going to kind of move up the spine.
Nothing there.
Nothing there.
Nope, still nothing.
Nothing. That's a good sign.
And then kind of right there is where I start to feel it.
Right in here.
Mm-hmm.
Okay, we're going to do some deeper massage work on that in a minute. Right now I'm just going to loosen up this back and do a little, you got some tightness in that lower back, so I'm going to work on that. Let's do the traction in there. Let's get right in here and loosen this up for you. I'm going to go down the glutes here. How does this feel? Any tenderness in here?
It was kind of like right on the side right there, but other than that, nowhere else.
Okay, right in there. Along the tensor fascia, a lot of muscle here. How about on this side?
Same.
Same, little tenderness in, right through here?
Yep.
Okay, let's go down.
Nothing.
Nothing?
Nope.
And,
Nothing there either. Okay.
still feels good to loosen them up though.
Yeah.
It's always nice to get that body to unwind.
I mean, I won't complain.
No. Everybody says this feels good.
You can get one of these for home.
Mm-hmm. Alright. Now I'm going to switch tips. I'm going to loosen this up a little bit more through here. Extra work through here now. Just just a little bit more. There's clear these. All right. Take a little breath for me. Oh my God. That squeaks a lot. Lock this knee and lift the leg up in the air. Hold tight for me right there. That's pretty weak. Sit that down. This one, hold tight for me. That's pretty weak. We're gonna have you slide down just a little bit right there.
Sorry, I'm short.
Oh, you're okay. Bring that leg back up. Hold tight for me. That's better. Bring this one up. Hold tight. Getting better. I'm gonna pull right through here. No, don't let me have that one. See, the main problem here isn't low, it's up high. At C3 and C4 right there versus the lower ones that are not as stuck. Except for that one right there. Can you feel that one?
Mm-hmm.
Yeah. So what I want to do, so I'm going to have you switch tables over to here. And go onto your back for me.
head up here?
Yeah, put your head up there for me. Got some knots right in there. Am I pushing too hard? I just kind of want to massage that just a little bit and get those knots out of there. Yeah, I'm going to clear this one right here. Here we go. We're going to drop back now. Let your whole body kind of unwind and relax. And I'm going to do this one over here. Bring it back. How'd that feel?
Very good.
Yeah, that go nicely. Now I'm going to do a little decompression on that spine.
Okay.
So you're going to lift up for me and head down. And I'm going to traction that out a little bit. This is my own favorite technique here. I call it the Owings technique. Take a deep breath in, all the way out. Feel a tug.
Oh.
How'd that feel?
Very
that was
good.
a huge relief.
That was really nice.
Oh my goodness. As soon as I started pulling, it started clunk, 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 clunk.
Mm-hmm.
I don't know if the camera heard all that, but that was awesome. I'm going to check those. Come up to a sitting for me. Let's feel the motion there. Remember that spot that was sore? I want to see if I've got more work. So I'm going to tilt the head back and then back this way. How's that pinch you feeling?
Definitely not as prominent as it was.
Good. Try this side. Bad?
Nope. I hardly feel that one.
Nice. Yeah, that was a nice change in there. Let's check the nerve roots and see if they're responding correctly. Hold that right there and hold tight. I'm going to push down. What do you think?
Better.
Yeah, it's getting there. I like it. Hold tight for me. That's getting stronger. Triceps, push up as hard as you can. That's almost full strength. Nice. Push up here. Okay, that's good too. We still got some muscle work in here we're going to do. But let me clear out your lower back.
Okay.
So now I want you to lay on your side there. Like you've done. Perfect. Bring this arm this way. This one this way. And we're going to go slow. Nice. Let's go to the other side. I do like how well you move. Your body wants to get out of pain.
It's like it's ready.
It's ready. I like it. Now we're going to go right here. There we go. Okay, on the back. Do a quick check before we dive deeper. Hold that leg right there for me. Stronger. Bend it in. Hold tight for me. So I still got some more work to do. This nerve root here is still a little weak. L2, L3. Bend it in. Hold tight for me. I shouldn't be able to push that down.
Okay.
So we've got some more work to do. So before we take that dive, we're going to do some muscle work.
Sure.
I want to get all the knots out of the neck and shoulders, and then we're going to clear them out again until we get everything locked in.
Okay.
So you have some interesting tattoos there. What's the significance of the heart sounds?
So I got that one after I graduated nursing school, kind of as a congratulation, and then the ribbon is a lupus ribbon for my sister.
A lupus ribbon?
Yeah, she was diagnosed with lupus when she was 18.
Okay. And what color is a lupus ribbon?
It's purple. It's kind of faded now, but.
Okay. I know we have the different colors that we use.
Mhm.
So what I'm going to do, is your sister doing okay?
Yeah, she's doing great. She's been in remission for several years now, so she's kicking butt.
And how old is your sister?
Now she is 26.
26. What does she do?
She is a school teacher.
Nice. That's a good profession.
She likes it. She teaches over in Detroit. Her and her husband live there.
Nice. So she's been out a few years then?
Mm-hmm.
She didn't catch the nursing bug like you?
No. No.
No. You're in a demanding profession.
Yeah. Yeah.
Rewarding and demanding, just got to pace yourself and take care of yourself.
Mm-hmm.
And I want to spend some time talking to you about that.
Sure, that's kind of something I've always not been good at. So, I hit 30 and decided it was probably time to start taking care of myself. So
you'll live longer and happier.
Yes, that's what I kind of like to think. So did too much, college partying in my 20s and
college party. Oh, I don't even want to talk about that on camera.
That's a secret conversation.
I'm telling you. Let me put my first year GPA was not that high. Took me a couple of years to get that stuff straightened out.
Yeah.
Clearly I got through it because I wouldn't be a doctor and go to grad school if I didn't get through it. But yeah, I think I managed to get a 1.8 cumulative GPA in my first year.
Ooh, look at you.
Yeah, we don't want to talk about that too much on camera.
No. Look at you now.
Yeah, I know. Straightened myself out.
Exactly. It all paid off.
Got it all fixed up. But yeah, I played too much.
I think that's kind of very reminiscent of when you first go to college.
Yeah,
excited, and you're an adult now.
I can do what I want.
Oh my gosh.
You can, but you pay a price for it if you're not careful.
Mm-hmm. I could go back and tell 18-year-old me lots of things.
Oh yeah, me too. Like, dude, don't do that. Oh, there's other stories, but we'll just not put those on camera. Unless you can do a lot of editing.
Right.
So, my worst, I was also, when you're first, drinking and stuff, college, you're being stupid. So, one time, I think it was our first year, I got so drunk. Hey, it's real. I ate an entire frozen pizza. I didn't bother to cook it. I just ate the frozen pizza. I proceeded then to eat the philodendron that was growing.
Oh my God.
Ate that. Being still hungry, I proceeded to eat a couple of raw potatoes.
Oh my God.
And ate those. And what happened after that later that night, we can only guess.
Oh, I can imagine.
All over the floor. And it wasn't my house.
Oh no.
The plant was gone, the pizza was gone, and the potatoes were gone. And the roommates were happy.
We're like, what the heck happened?
Turns out philodendrons are poisonous.
Oh,
that's probably why I threw it.
Right, probably. Maybe it was, it was helpful.
Never, ever did I do that again. Let's just call that a really good turning point.
Right. It was one of those eye openers that sometimes we all need.
Oh my goodness gracious! I'm glad it didn't kill me.
I am too.
And back to grad, then straightened out on to grad school, and pretty normal after that.
Well, there you go.
Well, there was one other thing. So I have 3 different black belts, and so we were seniors at this point. We're all done, wrapping up, graduating, and decided to have a tequila party.
Oh, jeez.
So then, being a newly minted one of 3 different black belts that I had, I wanted to see how strong I was, and so I wanted to see if I could handle punching a hole through the doors. And so I took out all of the closet doors with my fists. So I had to buy 6 doors in the dormitory. I punched holes through them. Which then got back to my senior instructor, Sophia and Charles Scott, who had a long conversation about it. Let's talk about you as a first-degree black belt representing the dojo. Punching holes through the doors of the college.
Yeah, probably not.
Where I teach at.
The best idea.
In philosophy. Probably not a good idea to have happen.
Oh, goodness. You said you have how many black belts?
I have 3. In weapons and Shudokan and Gosokuru.
Wow.
Okinawan form, Japanese form, and then weapons.
Impressive.
My body still hurts acquiring all those disciplines.
I can imagine. That's a lot of hard work.
It was. But it was very rewarding.
Mm-hmm.
It kept me out of trouble.
Well, that's good. Hey, that's good.
I can still go back to my stupid self at 21, 22, and I wish I could, I don't know. You have to be smart.
Yes, you do.
Otherwise, you can end up dead if you're not careful. I'll tell you that.
Mm-hmm. I think that's why I enjoy working with, in peds, you think of like little kids, but
Yeah.
I really do enjoy the time too that, I get to actually like talk to my adolescent patients.
Sure.
And, kind of help them through things that, they did nothing they could help through, so it's always very rewarding.
That is good. It's a good attitude.
Mm-hmm.
It's a good way to live.
Try.
So I make redemption every day of my life for the past wrongs and the stupid things I did by helping people. Don't do the stupid things.
Yeah. Like, right now you have all the answers, but trust me.
You don't really.
You don't. I think my parents and I have had that conversation too. It's funny now, the conversations you have with your parents as you become an adult. Because they were doing the same things that we were doing at the same age.
I remember conversations my mother said, well, I could have told you about that, but then you wouldn't have learned. So I let you just screw it up on your own. She still helped me and paid for school and stuff because she knew what was going on. But she's like, I already knew. We had the money to help you. We paid. We fixed everything, but now you know. I'm like, yeah. There we go. No, I don't want to go too hard. So is that okay?
Yeah, it's totally fine.
Just trying to scrape these muscles, and this is where you're having a lot of problems, right up here in your upper neck, where you probably hit and really hurt this area. C2, C3, C4.
Mm-hmm. Yeah, that always seems to be where I have the most tension and pain, and then it just kind of happens to go down into my shoulders.
Yeah. And does it roll down through here on both sides?
Yeah, on there, and then whatever this behind my shoulder blade on the right side.
Down over here.
Mm-hmm.
Now those are going to be, you're probably going to feel some ribs up here with some trigger points in those muscles there. But what I want to do is unlock these muscles some more, and then I'm going to, after they've calmed down a little bit, then I want to do a traction, some more decompression, and see if I can pick up a few more to let go for you.
Okay.
Get you some more relief in that neck area. But now you're starting to let go a little bit here. I'm going to go down these muscles. What I'm looking for is trigger points. And just make sure we get all this stuff out. Now I'm not feeling, are you feeling anything in here that's bothering you? It feels pretty good. Let's go ahead. There's what I find and what the patient feels. Both are valid points of concern for me, Anything in there?
It feels tight right where you're
pushing
there.
So I felt a little resistance, and you're feeling it too, so we're going to work on that a little bit here more. Again, if the pressure becomes too much, just give me a holler. Mm-hmm. I can sometimes get aggressive in there.
It's fine by me. I used to have my friend stick her elbow in my shoulder because it would be so tight, and that would be the only thing that would feel good. So she'd just shove her elbow in there.
Ouch! Golly.
It's one of those things. Yes, it hurt, but afterwards it felt really good. I guess that's an indicator of how screwy my shoulder muscle is.
I hear you. Now that feels a little better right there.
Yeah, that definitely does.
Okay, now I'm going to play along this muscle here. So I'm going to have you take this arm and put it behind your back. I just want to open this up. And how's that feel in there?
It feels good, yeah.
Okay, that's in there. Good deal.
It is a little tight right there, but it's not
right through here?
Yeah, it doesn't hurt. It just feels tight.
Let's work on those muscles a little bit there. Wait a minute. Right there.
Mm-hmm.
Now, is that about where you feel the tightness behind, or is it up higher when you're feeling?
It feels directly in the middle of my shoulder blade.
Like here?
Yeah.
But underneath or on
underneath.
top? Okay.
Yeah, so if I could like get my fingers under there.
You would go under here and find it.
Mm-hmm.
Okay. So it's a rib probably stuck up in there.
A rib?
Well, yeah, you know, ribs articulate here and they wrap around the front. So you can get a little twisting in there and you'll feel it. It'll just, because the scapula, you gotta remember the scapula is it's considered a scapulothoracic joint as a joint, but it's a free floating, just kind of floats there, and, and it has to, the scapula has to glide up and down, and so it's not a real joint, but it acts like a joint, and you can get a rib in there and you can feel it float up against it and rub on it, and you go owie.
Maybe that's what it is.
I mean, that's a simplified version, but still works.
I believe you.
It's all good.
This is definitely not my wheelhouse, so.
I study all the time, and I still feel like I don't know a damn thing. I'm like, really? I got 2 more postgraduate classes coming up on muscle scraping techniques, and sometimes I'm like, what's that muscle called again? I mean, I clearly know what I'm doing, but it's just sometimes you're just like, golly, there's just so much.
Yeah, I'm trying to remember, I mean, all of these different things, you know?
Yeah, and then just communicate to patients, you know. I mean, I know you're in the medical field as a nurse, but the challenges of communicating what's going on can be always a challenge. Mm-hmm. And then have it meaningful for them.
Exactly, yeah. Trying to have a meaningful conversation, but still get your point across.
Correct. Without doing science speak on them. You get lost on you. All right, I like the way that feels there. So what I want to do now is clean the bag. I want you to put that arm down. I'm going to do some other work here real quick, and then we'll clean the back. And then I want to go back in. I want to double check, triple check, quadruple check the neck, wherever I'm at. I don't know how many times I've done it, but we're going to keep going until we get that locked in for you. And then we'll do a little lower back, make sure I got all those locked in. And then we'll get you out of here to go play.
Sounds good.
Perfect.
We're going to be like, read a book in bed and go to sleep and get ready to go to work tomorrow. But
I hear you. So, how's the soft tissue work feel?
Good. Yeah, I feel very, like, I stood up and I was like,
oh, okay.
I was like, okay. I was like, I feel pretty good.
So what I'm going to have you do here is I'm going to double check the neck one more time, a little bit more traction again. Now that we've relaxed those muscles, I want to see what your body will let me do. There we go. All right, I'll lock this in. So take a deep breath, let the air all the way out. I'm going to bring it to tension. I'm going to give a, oh, feel that one? Mm-hmm. Yeah. Ooh. Wow, I think we got about 4 more out of there.
Yeah, I was like, I felt it like deeper this time.
Yeah. Mm-hmm. Okay, let's check that. Come on up for me. That was a nice release again. Ooh. So, I just want to try to see if I got any more gain on this. So I'm going to go sideways and bring it back. What is it?
No pinching.
No pinching. Nope. We got it out of there. Nice. Let's go up to the tricep or the deltoid reflex. Hold right there for me. That I think is even stronger. Yeah. I had a little bit of wiggle. Hold tight for me. You're not moving now. One more time. That's a lot better now. Okay. Go ahead and go on your back now. Here on your back. You still want to check the lower back here again. Alright, so bend the knee. Hold tight for me. So there's our weakness we're going to work on. So we're going to check that. I'm going to have you push right here with your hands. Just like we're going to go right about there. I'm going to double check this. Hold tight for me. That's good. So don't let go. I'm going to traction this out. So take a deep breath. Let the air all the way out and push in.
That was different.
Did you feel it move?
Yeah.
Yeah. That let go big time. Deep breath in, all the way out. Wow, those move good. Arms by your side. Let's challenge that. Hold tight. What do you think?
That's just, okay, that's a little bit insane to me.
Everything's wrong. We're not done yet. So let's bend both knees. We're going to check the adductor, so squeeze tight. That's locked in. Let them down. Point your toes towards your feet. Hold tight. That's strong. And those aren't moving either.
That's for try that one. Point your toes to your head.
Oh.
Point your toes
Point your toes to your feet. I knew what you were saying.
Oh my goodness. Edit, retake, take 25. Point your toes towards your head. You might leave that in for a fun reel. Point your toes to your feet. How do you do that? Hold tight.
Very carefully.
But you knew what
I knew what you meant. I knew what you meant.
Okay, I'm going to take the shoes off. Because I want to set the ankles. Do you have good, you got good toes. Look at that purple. I like that.
Oh yeah, I know. I wasn't forewarned on my toes. I would have painted them.
Paint your toes. Now what is this?
It's very old. Love is patient, love is kind. It was kind of on a whim.
You kind of want to win. Take a deep breath, all the way out. That move, I like that. And we're gonna do this one here. Oh.
Yeah.
Okay, now I'm gonna work on these toes. So let me get my stuff I need. I'll have you take your socks off.
Oh, remember.
These might be the best toes I've had all week. You can tell how good you are by the toes.
That was the most cracks that you got. All
Swing around, yeah.
Hey, I'll wait.
Let's do the wrists for me here. I'm gonna check these out real quick. Good, let's do this one.
You want that off?
Yeah, you're good. I'm just, whoa. Everything's moving. I like it.
Oh no.
Okay. We can adjust about every bone in the body. All right. Let me check the elbows here too. Did you? No, those are actually stable. Okay, I like those. All right. Let's see where we are here. How's your body feel right now?
A lot better than when I first sat down.
Yeah.
Yeah.
It moved really good.
Yeah, I feel like, I mean, I'm sure it's normal to feel a little bit sore just from all the movement, but I mean, I'm excited to see
We moved a lot.
what the next couple days bring.
Just talk to me. We'll figure it out.
I'm gonna call you and be like, hey.
Hey, come along. It's not uncommon to be sore, and we got a lot of neck work out of that.
Yeah, no,
More
I just,
than-
I mean,
Yeah, that's good.
I feel like I could go do cartwheels or something. I'm not
Don't
going
do
to,
cartwheels.
Bill.
I don't need that injury coming up.
Right.
Cartwheel, man, I busted my knee. That'd be bad. Okay, so we have a thing here. It's always to go play. So today we're done. You get to go play.
Alright.
And then we'll do follow-up videos on. We'll move into nutrition work with her. We'll talk about that.
Yeah, definitely.
And if we can make some changes, then we'll do follow-up interviews and see and integrate those. Might see if we can take it to the next level.
Yeah.
All right.
I'm in.
Go play.